The Gracey Curets are considered area-specific instruments, and we will be demonstrating the Gracey SAS-12, Gracey 1516, and the Gracey 1718. We will start with the Gracey 1718, which is area-specific for distal surfaces for posterior teeth, and we will begin on the mandibular left facials. Check your position, your patient's position, your grasp, and your mirror hand. Place the end 1/3 on the distal line angle so that the terminal shank is parallel to the long axis of the tooth and the lower cutting edge is on the tooth. Fulcrum close to the tooth so that you can maintain proper fulcrum, angulation, and grasp, about 2 teeth away from where you are working. Close the blade to insert to the base of the sulcus, then open to 70 degrees. Shank will be parallel, and start to activate your strokes with short, overlapping strokes. Use wrist activation and pivot and roll around the tooth to keep the side tip adapted to the tooth. Continue the strokes using the end 1/3 of the blade until the midline of the interproximal is covered. Close the blade and gently pull out of the interproximal. Continue to the next tooth. Remember, lateral pressure should only be used on the activation stroke or pull part of the stroke. Watch the terminal shank and not the face of the blade as you go around the tooth. This will help with insertion and angulation. You can see if you have the wrong end if the terminal shank goes across the facial surface. Next, we will go to the mandibular right lingual and do the distals. Palm is down, fulcrum more anterior, lean into the lingual and you will be using indirect vision. Slightly close the blade. Insert, then begin short overlapping strokes as you go around the tooth from distal line angle to the midline of the distal surface. Note the type of wrist activation. Come out and go to the next tooth and repeat. Start about 1 stroke before the distal lingual line angle. Remember to insert lightly, activate with lateral pressure, insert lightly, and then only use lateral pressure with the activation stroke. Now reposition the patient, the light, and yourself to work on the maxillary left facial. After you are positioned correctly, notice the palm is up. Close the blade and insert to the base with the end 1/3 of the blade anterior to the distal lingual angle. Make sure you have the correct end. Check terminal shank. Begin your strokes. Notice the position of the fulcrum toward the occlusal lingual. You must roll and pivot on the fulcrum to keep the end 1/3 adapted to the tooth as you do your strokes around the distal of the tooth. Keep going until you cover a few strokes past midline of the distal surface. Repeat for the lingual of the maxillary right. Notice the patient head position and fulcrum position a bit more toward the facial. Make sure you are using wrist activation and each stroke is going to the base of the sulcus. Next, we will demonstrate the Gracey 1516. This instrument will be used for the mesials and also the facial and lingual surfaces. We will move to the maxillary right facial surfaces. Change your position, your patient's position, and your light. Check your grasps for both hands. Make sure you are working with your palm up. Check to make sure you have the correct end, terminal shank parallel, lower cutting edge against the tooth. Notice the fulcrum placement. Insert the end 1/3 of the working end at the distal line angle and begin oblique, short, overlapping strokes. Try to keep the leading edge under the tissue if possible. Be aware of the angulations. Keep it correct as you go around the entire tooth. You must also do a lot of pivoting on your fulcrum as you go around the mesial line angle. You can even move within the positioning zone more toward 12 o'clock. Next, we will move to the mandibular arch. For the mandibular right facial, make sure you and your patient are in the correct position. Check your lighting and the grasp of both hands. Make sure you have the correct end. The terminal shank will be parallel to the long axis of the tooth, and this is easiest to see on the mesial surface. This will tell you that you have the correct end. Place the end 1/3 of the working end of the Gracey 1516 slightly past the distal line angle. The lower cutting edge should be against the tooth. The strokes along the facial surface will be oblique, so insert the blade to the base of the sulcus and then begin your strokes. They will be short and overlapping. Continue to the mesial line angle where they will start to be more vertical as you enter the mesial interproximal surface. Follow the contour of the base of the sulcus, which will usually come up at the line angle and then dip down more apically in the caul area. When you have covered half the mesial surface, close the blade, then remove the instrument. Then move to the tooth in front, the premolar. Again, begin at the distal line angle, insert, and start your oblique overlapping strokes. You will be doing a lot of pivoting on your fulcrum to keep the end 1/3 adapted to the tooth. Make sure you maintain the 70-degree angulation as you continue around the tooth. Also make sure your activation is completed using your wrist. Remember, the lateral pressure is only on the activation and not insertion part of the stroke. You can tell if you have the wrong end of the instrument if the last bend in the instrument closest to the end is away from the tooth. The face of the blade is away from the tooth and the terminal shank is not as parallel when placed on the mesial and your fulcrum. The last instrument we will demonstrate will be the Gracey SAS-12. We will now do the mandibular anterior teeth. Starting on the mandibular facial surfaces toward, make sure the chin is down. Insert the end 1/3 to the base of the sulcus about 1 stroke before the midline of the tooth. Make vertical, short, overlapping strokes and continue around the tooth until half the interproximal surface is covered. Make sure there is no lateral pressure on the insertion strokes. As you go tooth to tooth, make sure the patient turns their head so that the tooth you are working on is in front of you. Pivot on your fulcrum and maintain your correct angulations. To do the facial surfaces away, you will be sitting at 12 o'clock. For the facial surfaces, the patient's head will be slightly tilted up. The strokes are the same. Insert at the midline, begin short, overlapping strokes. Notice that you must fulcrum on the incisal edges. Watch the hand position and wrist activation in the area. It is more of a waving activation than a wrist rotation. This will depend on your fulcrum position. Next, move to the lingual surfaces toward and have your patient go more chin down. Make sure your hand approaches the teeth from the side. Fulcrum on the incisal edge. Begin again at the midline and complete your strokes. Make sure you pivot on your fulcrum and roll your instrument to activate your strokes. Also, again, be aware of your angulation as you go around the line angle into the interproximal surface. Next, go to the maxillary anterior facials. Change your position, light, and patient position. Find the lower cutting edge and determine which direction you will be scaling. The lower cutting edge will be against the tooth. This is the hardest instrument to find the correct cutting edge. You can place the instrument against your finger and look for the reflection of the face of the blade. It will reflect light more than the back of the curette. The face should be towards the tooth. We will start on the surfaces away and be sitting at 12 o'clock. Center the tooth you are working on with the center of the patient's body. Place the end 1/3 of the cutting edge about 1 stroke before the midline of the tooth. Insert to the base of the sulcus and start your short, overlapping strokes. Continue vertical strokes until you cover 1/2 of the interproximal surface. Make sure you are using wrist activation and pivot and roll on your fulcrum. After you finish one tooth, continue the same strokes on the next tooth, starting again at the midline. Make sure you maintain the correct angulation around the tooth. This is easy to see because the shank will be parallel to the surface you are scaling, since the blade is already offset at 70 degrees. We have reviewed 3 of the Gracey Curets, the SAS-12, 1516, and 1718. Please view this video to aid in your practice skills.